I'm Sanjana Chauhan. I'm going to be moderating. I've been a broadcast journalist for about close to 10 years, reported during the pandemic, and largely focused on how the media can address misinformation, especially when there is vaccine hesitancy, especially when all of us need to stand up and realize that public health is a real concern. So without much delay, may I invite all of the panelists up on stage to join me. And I'm so honored to be on a panel full of women. I know we have been constantly talking about this all day and balance and, but I think it's crucial that we have women representing issues that impact women and really talking about the power of the media and what women can actually do for better health-seeking behavior. But before I go on, let me allow each of our panelists to introduce themselves. Over to you, Zofeen.
Hi, everyone. My name is Zofeen Ibrahim, and I'm a journalist based in Pakistan, city is Karachi. I've been working as a journalist for the last 30 years. I have covered health issues, a lot of health issues, even reproductive health issues. But I also write on other things. I, by default, have been working a lot on climate change, energy, water issues, also a lot of human rights issues, women's rights, and women and children health issues as well, and the list goes on.
And HPV is at the intersection of all of these.
Yes, things. That's true. That's true.
Thank you so much. Thank you so much for joining us. Over to you.
Hi everyone, my name is Bu Sulin. I'm the editor-in-chief and co-founder of Code Blue, which is a health news site based in Kuala Lumpur, Malaysia. So I founded it about 5 years ago in 2019. So we cover exclusively healthcare issues with a very small editorial team. There's only 4 of us. It's me. I do everything. I have 2 health writers.
You're a lean machine.
And yes, we are a sub-editor. So we've covered, of course, HPV, vaccination, cervical cancer, among all other public health issues. We are among one of the more popular health news websites in Malaysia, at the risk of blowing my own horn.
Okay. Hi, I'm Mira, and I was in radio, presenter and producer for about 14 years. I hosted a health show, and we covered everything, disease management issues, whether it's policy-making issues, speaking to activists, social movements, all of that. We've done the whole gamut, and happy to share, a lot in this session. Please ask questions. I love it when it comes from you because it's always a lot more relevant.
Good afternoon. My name is Mia Malan, and I'm from South Africa and the editor-in-chief of a media organization called the Bekesisa Center for Health Journalism. We are 10 years old this year, and we originally started off as the health desk of an investigative newspaper. And just before COVID, we became an independent media organization. So we publish our copy on our website, but also in all the mainstream publications in South Africa. So each story is published 5 times in all the publications mostly. And we also have a national television program now and a current affairs program as a result of partnerships with television stations we formed during COVID.
As we have been seeing, and through the day, we've been hearing about 90 seconds. We've been hearing some pretty staggering statistics. We're talking about tragedies that can be averted, they can be prevented. But yet, I find that HPV, cervical cancer prevention, is missing from the public narrative when it comes to the media. We're not seeing that many journalists, we're not seeing that many reporters actually talk about it. And that's particularly surprising given COVID-19, given that the focus has turned to public health, given that health journalism is not just another tab on a website, but it now takes on front page. Mia, why do you think that this happens?
So we've heard so many comparisons with HIV, and I think HIV is very, very different in the sense that there was a common enemy, for instance, in my country, in South Africa, to fight when our government was in denialism. And that makes it a lot easier to advocate for something when there when people don't agree on the science, and there's same thing during COVID to fight specifically. But I think for an average newsroom today, newsrooms don't have money any longer, so they really don't have health reporters. The reason my organization exists is because of donor funding. And because we donor funded, we don't have to do the daily news, and we have time to spend on stories. Mainstream news organizations no longer can do that, and to then try and, it's a weird thing, cancer caused by a virus. It's for a person who's not a science person, it sounds very weird. For an average journalist or news editor to know about this is a tough thing, and if the journalist is not a specialist, in other words, if they don't have the knowledge to convince their news editor, who wouldn't be a specialist, to take that, to come up with a news angle, to know enough to make it a strong story, then the story is just not going to make it.
So would you say that that's something that you potentially face as well in Pakistan?
Yes, it's absolutely right. And the reason why it's absent from media is because I think even the health practitioners are not talking about it enough. They're not making the noise that they should, because obviously we get news from them. If they're not talking about it, we will not write about it. And again, if the news editor is not convinced, because we don't have the information from the medical practitioners or the fraternity, how will we know what to write about? The other thing is that, and I'm talking about Pakistan, that Pakistan is beset with so many other issues, and just talking about health issues and just talking about diseases, there are so many other diseases that are killing children, for example, because if this is going to be in routine immunization, then people will argue, and the news editor will argue, that more kids are dying from diarrhea or typhoid or TB, and cholera is coming back, and diphtheria is coming back. So why do you want to talk about HPV?
I completely agree with you, because there's always competing priorities in a news cycle that becomes hard to really justify why you would focus over one story over another. But you also raised a very interesting point about the information that is being provided, which brings me to my next question. What challenges have you encountered when it comes to addressing misinformation, hesitancy, and particularly exacerbated during the pandemic?
I think before we go to the part about misinformation about a vaccine, about vaccines and vaccine hesitancy, which has come out a lot during the COVID pandemic. But I think I'd like to go back to what my fellow panelists said about writing stories and getting featured in the media. I think that actually is one of the main problems when it comes to promoting HPV vaccination. The advocates and the activists, not just doctors, it doesn't necessarily have to be doctors, but of course patient groups and civil society, they have to be able to, so you guys just have to pitch interesting stories to the media, and of course explain it so that the media, the mainstream media, who are not very familiar with health news, can understand what you're pitching. And of course for journalists who are already in the health beat or who run health news websites like the two of us here, you cultivate relationships with them. Because news is new, right? So of course, a lot of these public health issues, they are there, they have been there for a long time. But why is it that certain conditions get more coverage? Is because the advocates know how to push for it, how to pitch for it. So if that's one thing that I can give to the audience here, is know how to pitch your story, find a new angle, a fresh angle. Of course, like I said, issues have been done a lot of times, but there are ways to do it. So like, for example, for me, when I first met Prof. Dr. Wu Yin-ling here, and I interviewed her in 2019, and she came up to me. So the way she pitched it was, I have this revolutionary new way of combating cervical cancer, of testing for it in a way that's less uncomfortable for women. I thought, okay, that sounds interesting. I mean, to me personally, I'm fine with pap smears. I understand a lot of women are not. So that's a new pitch. So I think that's one way to get it across.
According to me, the single biggest challenge with news stories not making it out or not being read, because it doesn't mean if it's published, it's going to get read, is the language that's used. Because we donor funded, like many of you, we have to measure impact. So our donors want to know that their stories had an impact. And so we monitor it quite closely. As soon as a story has easy language, and by that I don't mean easy sentences, I mean when it's de-jargoned, it has considerably more engagement. So if we publish a story and we say accelerating the fight against HPV, no one's going to read it, right? Accelerating would be jargon. If we're going to say things like a comprehensive approach or holistic, or if we're going to say something like amplifying the voices, those are non-terms to use in news stories. But the thing is, because you get general reporters writing stories, the less you know about a subject, the more jargony you get. I think it is harder to de-jargon a story than it is to get it accurate. And accurate information is absolutely useless if it's not interesting and if people don't understand it. And we've got a decision-making audience, so you would think the policymakers can all understand the jargon. The thing is, today with online, there is competition to open stories. So you're going to open something that looks the most interesting regardless of whether you understand jargon. And jargon in a news format makes it boring. So when we edit stories, we spend 60% of the time on de-jargoning it as opposed to just getting it accurate.
Yeah, I think it's often about whether it's clickbait or whether it's sexy enough to make it, to the news cycle. But Meera, you work in health communications. You work so closely with policymakers. Would you agree? And is this something that you try to infuse when you are communicating with policymakers and their communications with communities and women to simplify, to keep it really simple and to the point so that it just becomes easier to understand and far more approachable?
You're absolutely correct. Not every news organization has a health specialist writer or somebody who understands health, and that is the biggest challenge. I think, and a lot of them don't see the need to have a specialist writer because there's no money in it, because you have other priorities in the news cycle. However, let me just say, based on my experience in a radio station, there is money in it. So it's how you dedicate your resources to a health segment or, a page or editorial to the health segment. It's how you dedicate somebody who understands health and how this person breaks it down. And, industry is there. They're willing to pay you money for it. We had sponsors on the station. However, we made it very clear that content independence is with the station. So we're not going to do any hard sell, products, hard sell to anyone when we do shows. We don't even mention some company names. It's all about awareness, disease awareness, and whatever else that we want to put out there. So I think if you decide that this is what you stand for, it can be done. And let me say, there is money in it. It's how creative you are in coming up with this content, and it is justified. I think it is about time that we start having more health journalists, whether or not they are on radio or television or even in print. We need to do it. Otherwise, we're not going to achieve very much going forward when it comes to health. And the situation is getting more and more dire. It's just not HPV and cervical cancer. Malaysia has a huge problem with cardiovascular disease, and we're not doing well in managing that at all. And I have to say, the doctor just now who spoke about behavioral and social and behavioral science, I think that is really the future of how we are going to communicate with our audience. It's no more just shooting in the dark with general statements. You got to go to every different community. There's so many communities you need to speak to. And this social and behavioral science is going to inform how we actually speak to these individuals.
So I think that's a great point. And if now, can we, just let's move to the misinformation part of it, given what you said, because I see today that there are droves of content creators, right? And everybody is a content creator today. And while I actually subscribe to, and I think Instagram and TikTok is fabulous, there are a lot of people, especially from the medical community and the profession, that seem to think that it's not trustworthy. And I do understand where that comes from because of, we've seen a lot of misinformation, especially during the pandemic, especially after the vaccines came out. So, and that of course translates into every other disease, and even when we're talking about HPV. So coming back to you, Sulin, how would Code Blue really tackle, media getting a bad rap because of misinformation, because of, the fake news cycle?
Well, misinformation became a lot worse. We saw it started to emerge during the pandemic, and what's worse is that for some weird reason, vaccine hesitancy increased from my observations post-pandemic. And some doctors also have told me that they've seen vaccine hesitancy expand not just with COVID vaccines, but with other vaccines, other conventional childhood vaccines. For HPV vaccine, I think in Malaysia, Mira, I think I haven't really seen that hesitancy yet towards the HPV vaccine, which is good. But as to your point on how to handle misinformation, it is just having to constantly put forth the correct information. And if you're saying that some medical practitioners seem to dismiss Instagram or TikTok, I feel that's the wrong approach to take. You gotta be on these platforms. I mean, advocates, medical practitioners have to be on these platforms to produce correct information to the people, because if you're just gonna complain about misinformation all the time, but you're not doing anything to correct it, then you can't really fault people for falling for misinformation. And on Twitter especially, I do see quite a lot of doctors on Twitter. I mean, that's how during the pandemic, for Code Blue, the Code Blue team, Twitter was really helpful because we could get access to what different scientists believed about COVID and the new theories and latest findings from COVID. So we got that from a lot of scientists. Of course, there are a lot of doctors who were anti-vaxxers as well, but those could easily be weeded out.
And I think, Mia, if you would like to talk a little more about, the anti-vaxxers, because that's something that you spoke to me about, and I thought it was so insightful about the attitude when it comes to writing about people who are not in favor of vaccination.
Thanks, Sanjana. So something that worked for us during COVID at Bekasisa was to never respond to an anti-vaxxer, but to respond to their audience. So you try and reach the people that they're trying to reach. So if anti-vaxxers started to tweet about vaccines that are dangerous, say the side effects, that would have been a cue for us to start to do stories that break down how side effects work, and then to also have it all over Twitter. But I think we can learn a lot from people who spread this information and from anti-vaxxers, because they have orchestrated campaigns and they study the social media channels and keep track of how they change. So if you want to counter disinformation, it would just be stupid if you don't use the channels that they use. And if you look at how social media has changed, you're right. During COVID, Twitter was a thing. Threading on Twitter was a form of reporting. Now that has changed a bit because Elon Musk took over and it's no longer as authoritative. And TikTok and Instagram are starting to be legitimate forms of reporting channels. It's no longer a thing just to promote your story on. You actually do the story on it. So if you're a media organization and you want to fight disinformation and you don't upskill, it's a specialized skill to do TikTok reporting. If you don't upskill your reporters to do that, you're not going to have the effect that you need to do. And lastly, I think, to counter disinformation or to report authoritatively on a subject, you need access to information. And the people who give you access are government officials, it's scientists. They often mistrust the media because you report incorrectly. if you're consistent, I believe consistency is the currency of trust. If you are consistently correct, but if you're also consistently trustworthy, then you get preferential access to information. So in my country during COVID, that would have meant our government didn't give out information when vaccines arrived in the country because it was often reported on in a sensational way. We try to be trustworthy at Bekasisa and not be sensational about it. The result was that we could WhatsApp the guy who gets the stats, who would tell us what arrived, and we could tweet it out. But if we were going to once break that trust, we were never going to get it again. And that's something to be aware of.
I think I really like what you said about trust, because that's exactly what the audience told us in the sense of how they were feeling about the media. And Meera, I wonder, because you work closely with policymakers, you work in communications. I'm trying to understand what are the key messages, or what are really the tools, or the kind of communication strategies or plans that one must adopt to make communities understand and be aware, and especially women, empower themselves when it comes to HPV?
Yeah, it's multifaceted. There's just not one answer to this. So you need to go through to various groups of people, as I mentioned earlier, and it comes from a position of trust. You need to trust government. You need to trust people who are disseminating this information. If I could just use COVID, the pandemic, as an example of trust, you would have found that in Malaysia and Brunei and in Singapore, all the ministers of health had daily press conferences with the media to make sure that accurate information was actually going out. And to a very large extent as well, our vaccination rates were higher because there was trust in government. So I think if once you have a government that's established itself as a trusted body, especially when it comes to health, 3/4 of your battle is won. Then you just, start working with them to get these messages through to various communities. So I think that trust is very, very important.
But let's talk about Pakistan for a minute, because there's also the aspect of priming a community or a population that ordinarily has not even heard about HPV, has not even heard about a vaccine. It's going to take a couple of years before a rollout, and they've not even understood that there is screening or that there is treatment involved. How do you prime a population like that? What role does the media play there?
So I think media, hello, yeah. The way I would go about it is that I would use a human face to this vaccine. It's very important. Today when Genevieve and Summer talked about it, it really touched me here. And I think it brought tears to many. So that is one way of doing it. The other way is not to create too much drama, but still tell the truth. And this is a compelling way of doing things. And as others mentioned, that it's very important that there's a genuine kind of a rapport between the scientific community, researchers, and media, that we understand what they're saying. We need to go beyond the jargon. We need to come around it. We need to understand what they're saying. And then when we write, it'll be a more truthful and compelling story. However, I would like to say that in my country, we don't always trust the government figures. We don't always trust what the government is saying. So again, that becomes, the job becomes more difficult for us if you want to write the truth. The other thing, and I'll give you the example of polio. With polio, we did very well. And I'm talking about media. We haven't eliminated polio, but as far as stories are concerned, media is on the government side. Media is on the side of polio workers. So and a lot of stories are written around polio now. And they're always, if you look at a gamut of stories, they'll be very positively written. People are on the side of the government. We know what the problems are. media knows what the problem is, the government knows what the problem is. So, so there is that, the trust around this thing that what the government is trying to do is an honest way of driving out the virus. So I think we need something like that. But we also need to bring HPV in focus. We need to humanize it. Somebody used the word humanize it, and I think that just perfectly fits into bringing attention to this vaccine and the virus itself.
Absolutely. You wanted to add something?
Yes. I think what I wanted to add on is that let's talk about how breast cancer awareness did so well. I think it's taken them 40 years to get to where they are today. So the question is, how do we make HPV and cervical cancer the breast cancer story? And I feel it can be done faster. The reason it can be done faster is because we have so many channels to distribute information today. Unlike breast cancer, it was tough back in the day. So you need someone to take charge or take control of this whole program of communicating this to all stakeholders. And I honestly feel Ministry of Health should be working together with, in some countries we have ministries of communications, and to disseminate this information to either the media and to have everybody else on board, doing this as one. And I think that is really something that can be done. We can use breast cancer as an example. However, the difference with breast cancer is the women who we targeted were older. With HPV and cervical cancer, the women we're targeting are much younger. And so that strategy needs to change a little. And I mean, we heard from Aziko and Summer earlier on, and I think they know what's happening on the ground. Let's not pretend at 51 I know what is going to get a younger woman ticking in terms of her health-seeking behavior or even what she understands about HPV and cervical cancer. So I think we need to engage a lot more with the younger individuals and see how we can tailor this messaging and help them to put this out to the community and various stakeholders. When you talk about healthcare professionals, and I don't blame them. They're science-based, they're trained in science. It's very difficult for them to understand what the layperson understands. And so that's where, as health journalists, that's our role, is to break down the science for the public. I've been accused in the past of, by doctors who tell me, you dumb it down too much. But in my mind, there's no such thing as dumbing down too much, because the person I'm talking to needs to understand what I'm saying. So dumb it down if you have to. At least people will understand and get the basics. I always talk about, if you talk about cervical cancer, how many people actually know where their cervix is? Do women really know? Young girls, do they even know where their cervix is? Do they know what the role of the cervix really is? I mean, it's like going back to very basics of understanding where your cervix is and the fact that a virus can actually affect your cervix, and it will affect the function of the cervix as you grow older. So it's a simple messaging like this that can actually help people understand a lot better. But I think engaging the younger women is a way forward.
Right. And, we've also seen through the day, we've spoken about innovation, we've spoken about technology, and we've spoken about, telehealth and things like that. And I think that also needs to apply to storytelling and the media. It has to apply to journalism. You cannot imagine that in 2023 that you are going to tell a story in a print publication. You may, and you will have that certain audience that will, subscribe to it. But it is time now to also innovate. It's time now to have different storytelling techniques. Would you like to comment on that, Sulan?
The media does need to change the way they tell stories, but as we all know, it all boils down to whether whichever platform we use, can it generate revenue? If it can't generate revenue, then it's pointless going there. For example, Facebook, or if we were to put up all our content on only a particular channel, then that actually carries a lot of risk for the organization, because what if the company takes down your channel, or if the government takes down your channel, as opposed to having your own domain and website. So of course we have to keep that in mind. But having said that, yeah, it's interesting to hear that there's actually reporting being done on Instagram and TikTok. I haven't really seen that yet. I'm still stuck on Twitter too much, so that shows my age because I don't really like TikTok. But no, yeah, TikTok video reporting. Yeah, if you can explore those, if we have the resources to explore those, then why not?
So something we can't ignore today is AI. There is AI now. Now, to reach more people, you can use one story and produce it in different formats. So you can have a in-depth print story, and then you can produce a little small video, a 1-minute 30 video. But if you have a feature story and you also want to produce it as a news story and as a bullet point story or a listicle, it takes time. But AI, generative AI today, is very good with helping you with that, and it saves you hours of time. You would have to check it. So it's not a news story that it generates. It takes your in-depth story, and you can go into ChatGPT and give them very, very specific instructions, and it will pop out the story with bullet points and with news that you can reuse and now have many more formats in a much shorter amount of time. Of course, an editor is going to have to check it in the end, but I think you can also do it with videos today. So I think if we can't ignore AI today and how it can help us, yeah.
There's a huge audience and appetite for TV dramas, which you can call soap
In
operas.
India as well.
But they're not soap operas, they are dramas actually in the old style. And you know, this thing can be taken on, and because you will find a huge, huge audience, and they understand, and if given at prime time, I think that would make a lot of difference. The other thing is, and this is again very traditional, is in villages, we still have street dramas. And people can, you can, call people, invite, the villagers from other villages, neighboring villages, and you can sit and, have a small 20-minute kind of a drama. You can do that. You can have songs around it. So there are those old ways, and then there are these TikTok ways. And, I mean, at least I always consider TikTok to be very tongue-in-cheek, but it doesn't have to be anymore. It can be done in a nice manner, and it'll make a difference. I also think that, when you said that there were doctors who were coming on TikTok and misinforming, I think that the same platform can be used by good, respected doctors to, kind of subvert that. So, these are like some of the, and it has to be done all across, like diversity is the key to success, I think.
And multimedia.
Multimedia, of course.
I'm going to open the floor now to some questions if anybody would like to ask. We're almost out of time, so.
One thing that I think we haven't pointed out clearly, and you talked about breast cancer and other cancers associated with women. We've already said, I think 80% of cervical cancer happens in low and middle income countries. And I don't think we can overlook the fact that these are mostly brown women. And so cervical cancer is very much a disease that disproportionately affects brown and black women. And we can't overlook that will be a reason why it won't be as quote unquote attractive to media as breast cancer. You hear breast cancer, Susan G. Komen, you buy a cup of yogurt and you can't ignore the fact that, you could donate your lid. It was a big thing many years ago. Cervical cancer doesn't have that same appeal for some reason, and I wonder if it is because cervical cancer is not a big deal as much for white women. And is there an issue there that needs to be called out, the inherent bias that affects how cervical cancer is viewed because of who it disproportionately affects? Thank you.
In my country, South Africa, actually we have a story on that issue on our website today about the fact that it is the leading form of cancer that kills black women in the country. White women, it's breast cancer. It's actually quite a strong news angle in my country. To a racial issue is always a strong news angle in South Africa. So we actually broke it down why it is like that. Because it links to our history, it links to who has access to services and that sort of thing. So I understand what you're saying, that because it's poorer people, and like with everything in the health sector, when there's a drug that's being developed and it's TB and it's not the Western world, then there's fewer resources. But there are ways to turn it around. I think my country is an easy one to turn it around in because of the history.
And there are outlets. There are outlets now, I would say, that do focus on these issues like yours. And while we do see a concentration of supposed global media that would not touch stories like this, we're seeing really a surge now of more regional, multimedia news platforms and media publications that are reporting pretty fearlessly. So I have hope.
Thank you. This was indeed such a lovely panel. What I reflect on the fact is, when media needs authentic information from healthcare professionals, it's not necessarily always the healthcare organization leaders or the healthcare experts who can, present themselves on television, for example, or talk to the healthcare journalists, because that too needs a capacity building, because communicating in the manner that it is needed is also a skill. So I really think that the community of healthcare providers also need to be investing in communicating right to the people who then communicate to the world, and also within ourselves, since we have the access to be present on the social platform. And I can relate very well to the question on the cervix, because that was the first question I asked in a public forum. They said, yes, doctor, we know what the cervix is, because I had cervical spondylitis and I used the cervical collar for the longest time in my life. So, that was the start point of recognizing that our presumptions can be so often so incorrect. So thank you very much for this brilliant panel.
Sorry, that's a great point. It's exactly what I was thinking I've been sitting here from this morning, and I was thinking to myself, everyone in this room is speaking in a bubble. It is great to have these conversations amongst you because you need to mobilize, but there's a different world out there. They wouldn't understand 3/4 of the things that you were talking about today. So the question is, how do we do this and convey these messages to the public? Media needs to grow a relationship with healthcare professionals. That's what we did on the radio station. We ran it for 14 years, a health show 5 days a week, every hour for 14 years. It's going on still. I've left, but it still continues. But we have built relationships with doctors, activists, policymakers, and everyone. You need to build yourself as a trusted media organization for them to trust you. And once you build that relationship, they are happy to come forward anytime. One phone call, Professor Wu comes to talk about cervical cancer and HPV. We go back a long way because she's always been our go-to person for HPV and cervical cancer. There's so many other people we've built relationships with. And during the pandemic, that is something I found was lacking with many other media organizations who didn't have a specific health writer or a specialist. They hadn't built a relationship with experts in the industry. And so they were dependent on government to feed them with information about COVID-19 and the pandemic and everything. And they couldn't go beyond that because one, they didn't build the relationships with, they didn't have a database. And secondly, they didn't have in-depth knowledge to break it down for the public. So I think that media needs to establish its relationship with healthcare professionals as well. And that's a good start to start informing the public.
No, I'm actually curious, Sanjana, you said that some people in the audience don't trust the media. Why is that? If anyone in the audience...
We're asking the question back.
I'm genuinely asking if any one of you here doesn't trust the media. Could you explain why? Because I really want to know.
Nobody voted for news reporters.
I think the number of wrong news that comes in the media and it is very difficult for the community in general to see which one to trust, which one not to trust. And ultimately, trusted sources are much lesser than the non-trusted sources. So that's what makes it more difficult.
Yeah, so actually, I'm a younger person. I do use social media, but then I also realized that there are a lot of, like, for example, say video editors, but they would take like snippets of like different videos and make into a different story. And sometimes we cannot differentiate what is real, what is wrong, or not real. That really causes a lot of like distrust in the social media in that sense. Hope that helps.
Yeah, I'll speak from my own personal experience. I gave an interview once, this is many years ago, and after I was done, the reporter asked me for something in writing just so that they make sure that they get it right. So I put something in writing, very brief, and I tried as much as possible to dumb down the scientific information. When it was printed, I looked at it and I was, where on earth did they get this? It bore no resemblance to what I said. And this is with me saying it and writing it. And so that must have been one of the media outlets that didn't have a health specialist on board. So I guess my question to you is, what can scientists do to help media get it right?
Can I answer this? I think, I deal with a lot of scientists because I also write a lot on climate change, and there's a lot of science involved in it. So I would respectfully ask you to be very patient with us. We don't understand it. We don't get what you're saying. So we can ask you 3, 4, 5, 10 questions to finally get the answer that we understand. Because for some reason, you're not able to talk in English or in my language. And it takes a long time and a lot of patience for us also to understand what you're saying. So even if you you gave that person in writing, maybe it was still too scientific for her to understand or him to understand. And maybe she kind of tried to de-jargonize it and got it wrong. So I just feel that there needs to be more conversation, because even, today there were so many words that just went over my head. But for all of you, it was like so commonplace to understand these things. And, but we don't. Even in one sentence, there'll be so many words that we don't understand. So I think there has to be kind of a common ground to come to.
Yeah, if I could address some of the concerns in the room also. So we see fake news in the media. Well, a lot of the times the media just reports, right? We report what people say. So during the pandemic, there were a lot of vaccine hesitant doctors in Malaysia, and the Malaysian mainstream media, not Go Blue obviously, just took it point blank and reported, reproduced almost essentially word for word the vaccine misinformation that was being touted because they were doctors, and you can't really blame the media in that sense because they don't know any better. So I would say really the onus isn't so much on the media to build relationships with people. Of course we do, we want to, that's our job. But I think crucially also because it is your agenda, right? For us, even health journalists who specialize in health, there's so many areas in healthcare that we cover, so many. I mean, for Go Blue, for my team, we're a team of 4, and even though we only do health, Mondays to Fridays, I can't do everything. So I myself am always in a position of having to choose to prioritize which story, even though we only do health. And sometimes there are other stories which I would think is more important to the public, or also I'll be honest, because I think it gets more views. So you gotta, so anyway, to overcome that, you just need to find good reporters. I mean, I'm sorry for your bad experience with the journalist. That's actually very unfortunate and quite bad. But if you find any good journalist, then build a relationship with them.
They're keepers.
Yeah, build a relationship with them, and then you'll find that it's much easier to get your message across, for the journalists to understand you, and then for future stories of it.
Okay.
Hi, thank you for the opportunity. I'm Arisda from the MOH Indonesia. I'm very glad to get this opportunity to meet with the media experts. Well, let's take media from the health promotion aspect. So, like Ms. Mira said, that the HPV and cervical cancer screenings has also targeted on the younger crowd. And the younger crowd nowadays are like Somerset. They play social media. Most times, MOH posts so much information, so much health promotion thing that we try to keep up with some trends. But if there is no catastrophe yet, or there is no bothering things yet happen in the society, the crowd won't be there. So, but in the other ways, MOH can't wait to people get restless until we give the health promotion. So in this vicious cycle, how the media experts can give the best input to the MOH of Indonesia? Thank you.
If I had my way, I would work with Ministry of Education. And very briefly, when you're teaching children about the anatomy, to point out the cervix and the role of the cervix, and so they understand. So when they reach the age where you want to vaccinate and start educating them about cervical cancer, there is some basic understanding of how you can actually do that. So obviously it's not working. Your communication strategy is not working because you're not reaching your audience. So as I mentioned earlier, you need to start engaging younger people to see what works for them. The other thing I didn't talk about just now is this idea of gamification. The young people love gaming. Anything that leads to some sort of incentive or reward, they like. So how do you gamify information when it comes to HPV and cervical cancer and get people on board? So for Malaysia, for an example, if we were to gamify HPV and cervical cancer information. So that can look like a questionnaire. I mean, questionnaire is boring. You need to think creatively of how this can actually work. You can then team up with e-wallets, for an example. In Malaysia, a lot of people use e-wallets. How do you use e-wallet organizations or companies you infiltrate these e-wallet companies to get these questionnaires out, and how do you reward them in the process? So creative things like that. I'm just giving you a simple example, but I think you need to engage with the younger people and understand what works for them. So obviously what you're doing, you need to relook at how you're engaging with the younger people. What gets the Indonesian teenagers and young adults, women, ticking? What affects them? And then you work from there.
Sanjana, we've got 3 more questions over here, and I know we've almost approaching time, but do you think we can if we can get relatively quick responses from people, then I think we can get through the last 3 questions.
All right.
So I'm going to pass over now. Thank you for accommodating that.
My question relates to new media versus the traditional media that we used to. My generation will read newspapers, watch TV, and try to catch on with what is going on. The younger generation will do the gamifying and will do short, quick bites. But the big issue for me is how the traditional media that already has the captive audience is adapting to the new media to be able to engage the audiences with credible information. My question to you relates to how can we make sure that, one, we keep it relevant so that we draw the younger generation to start watching news and to understand the critical issues, but also how do we ensure that the traditional media remains relevant, interesting, and meaningful for us to be drawn to the science, because until we understand the science, we're still going to be talking to ourselves as a community. Thank you.
I often believe that to reach out to younger audiences, like we have been discussing, it's imperative that we keep up with innovative storytelling formats. And there are many journalists in Southeast Asia that have now turned to Instagram to tell short stories or the top headlines of the day. What tends to happen is that those news, which we earlier imagined were, just another Instagram post, have now started drawing accurate source-based information from reporters that are on the ground, or they are actually reels and short bites of news editors or reporters that are reporting from the scene of crime, reporting from outside courtrooms, reporting from outside police stations. So that's really the message. But in terms of how we can keep the audience that subscribes to a newspaper captive, I think it's imperative to keep long form alive. And we've seen that a fair bit. If I may take the example of Sabin's Journalism Fellows, we've just seen how they have leveraged the story of HPV and cervical cancer. I can speak about the example from India in a wonderful multimedia format, which has a lot of print, it has a lot of text, it has a lot of images, but it also has a lot of video. It also has a lot of interactive formats, which I think is great, especially for somebody who likes to read, but also interact with the content. So I think it's crucial to maintain that balance. And I hope I've answered your question. And if anybody would like to add.
Yeah, if I can just add on very quickly. Reality is traditional media is dying. You can see it in the West. You have publications who are shutting down. I have a 21-year-old and a 24-year-old who don't watch the news on television, who needs to make an appointment at 8:30 to watch the news anymore. I can consume news whenever I want because it's available everywhere. You'll be surprised that the young people are getting their news on TikTok. So you need to figure out how to infiltrate these networks and get to them. It is there. It's just a question of how to do it, how to understand their behavior. But yes, unfortunately, traditional media is still going out to the older people, and I don't know how long it will last.
How my Mbenda organization is adapting, one of my jobs is to raise funds. And I'm currently raising funds for a person, all I want them to do, full-time, is Instagram and TikTok. That's all they're going to do. Because without that, we're not going to reach the people we need to reach.
Hi, this is Mridu Gupta. I'm from India. 2 points I wanted to make. One was corroborating the story that Meera and Dr. Hema were talking about. So we did a survey across 21 cities in India to find out the level of awareness on cervical cancer. So 46% respondents said that they'd heard about cervical cancer, out of which 23% thought that it was a cancer of the neck. So effectively, about 20% people had heard about cervical cancer. But so we are an awareness organization and we use social media quite a bit. But if we had to put up a post of do you know, like we were trying to do for self-sampling of cervical cancer, and you show the woman's body parts, it'll get pulled down. We haven't normalized talking about the woman's sexual organs. We cannot show it. We have to use euphemisms for it. How do we normalize talking about it? While I understand storytelling is important, we also have to get the facts. We have to be able to say what is what rather than show an orange or show something else so that, Facebook won't pull it down. So how do we talk about cervical cancer or breast cancer and show it the way it needs to be shown?
You could explore augmented reality. I think you've got a ton of experts in India who'll be able to help you do that. And I think that could be something you could possibly explore. This whole idea of normalizing language. On the radio station that I was in, we just called a spade a spade. I remember a friend of mine came up to me one day and said, "My God, you said penis on air." And I'm like, what am I supposed to call it, right? So I think the more we push boundaries and start using these terms correctly, which is correct, there's nothing wrong with it, society will slowly get used to it. But you need to start pushing the boundaries. You can't be avoiding it forever.
I'm Sanjay Pandey from the Global Health Advocacy Incubator. It's really wonderful to have this stakeholder in the consortium as a media, so which is very important. And also, in my opinion, it is not either or social media or the traditional media or new media. We need everybody so that they are contributing as a stakeholder to these things. So my question is that we heard you as a mainstream media from the big cities and all, but there is a large chunk of the small media in the, say, small towns and other places, and they really play a very dominant role in all forms of media. How can you really engage them? Because they are influenced by that. And secondly, we are discussing here, but who controls the content and everything? Because the journalist doesn't control on that. So control is somewhere else. How can you really get even the control as a stakeholder for the HPV consortium?
Very important question, but extremely difficult. You know, we are grappling with getting regional journalists in different other languages to come and talk about other issues. I'm not talking about HPV. Is just not even, has not even taken off right now in my country. So one way I would suggest would be to have a cohort of journalists. Now, in my country, we don't have health journalism or health journalists because, as mentioned, journalism is shrinking. There's less money. So a journalist would have maybe 5 or 6, a reporter would have 5 or 6 beats. And he or she would have to cover that 5 stories in a day. Now imagine if it's like a regional reporter or a district reporter and who has never heard of HPV, and also consider that how conservative that area is, because Pakistan is conservative. Now in a regional area, you send him into the district where there is no, we don't talk about these things. There is stigma attached to STIs, taboos attached to talking about sexual health. So it would be very difficult, but very important to bring them across. And I think the cohort can be made of big city journalists along with those journalists, and they work together and do stories together. And you can use any media. They're using Mojo very frequently. They're using TikToks. They're using Instagram. So it's not that they're not using the new media. They're using those as well. It's just that they need more exposure. And that can happen if they work together with the more big city journalists, I think.
Or review, is there a possibility of having more engagement with healthcare professionals and these journalists from smaller organizations? That could possibly help as well, like on a weekly basis or monthly basis. You could do that. Or you can have a communications secretariat, perhaps a small pool that disseminates this information to smaller media outlets so that it's accurate and, it goes out to the right people. Just ideas, I don't know. I'm not sure. I don't understand the setup, but just ideas at the top of my mind.
Thank you so much. Any more questions? I'm so sorry, but we're completely out of time. And well over the limit. So thank you so much to my wonderful panel, the all-women team, all wonderful journalists, and very insightful conversations with an energized audience, even though it's end of day. Thank you so much. Okay.